I am here with Amanda. We're ready for Amanda's 1 month block therapy update. How are you feeling, Amanda?
We are. I am so ready. I'm so excited.
All right. Well, we're going to just jump right in. Amanda has some really cool updates, some things we didn't expect at all. Very surprising. Um, and a lot of progress. So we're going to share some of Amanda's pictures. She's feeling brave today.
I am.
And we're going to see
Putting it all out there.
we're going to see what we show you what we saw. Let's see if that works. Oh, there we go. All right. Amanda, you saw something right away in these first pictures that we're looking at.
I did. And it wasn't what I was expecting would improve. So in the picture on the left, the June 1st, right before I started, my left arm is not straight up. It's out to the side. And my hand is not forward. It's out to the side. And my other arm also isn't quite up parallel either. My breasts are lopsided, which I think I kind of knew, but we'll see it in another view. So
Mhm.
those two stood out to me, and I was like, thought that I was standing up straight in June 1st. And then in the July 1st, you can see how much more range of motion that I have in that arm. My hand is forward. Both of them are up straight. My head also looks more comfortable and like it's straight and not tilting back and scrunched. So I'll let
Yeah,
you chime in.
it's always interesting to me because you take these pictures and you think, I'm going to stand up as straight as I can. I'm going to like do the best picture I can so I can get the best view that I can. And then you see them and you're like, I tried as hard as I could to make my arms go over my head the right way. And we just get in these postures, how we stand in gravity and over time, and things don't line up the way that you think that they do. And it's a picture, it really is worth 1,000 words. And um, I know that your head being back, it puts so much strain, like on the back of your neck, but also all through your shoulders, um, even into your chest. It just creates a ton of tension, your upper back. And so I'm really happy to see those second pictures where you're so much more in line and your shoulders are down, your arms are up, but your shoulders are down where they're supposed to be and have so much more range of motion.
Yeah, and the interesting thing is I didn't realize that I had a range of motion issue until I saw the after picture and I was like, wait a second. Look at my shoulders and look at my arms and my hand and my head. And I felt that. I have had chronically extremely tight traps, neck, upper back, huge problems with that. So yeah,
So how is
really, really
that
happy.
now? How's that tension
Oh,
pain?
it's getting so much better. I've had a chronic pain in the bottom part of my neck on the right side of my spine, and I had a limited range of motion. And that pain, it's still like, I feel like it's deeper there, like it's still there, but it's not bothering me on a daily basis like it was. It's not limiting my range of motion like it was. And it's only been a month. So that is definitely getting better. And I'm
Yay.
just not as tense. I don't wake up and have like those tense muscles and have tension headaches like I did before. So yeah, it's amazing.
So yay. So one of the things we work on in block therapy is symmetry. And I think whenever we think about that, we don't think about breast tissue because it's not muscle, it's not attached to bone. And we kind of think, well, we can't really affect symmetry through a woman's chest. It's just not possible, especially kind of if, because I have this breast thing too, where it's like they sort of take over your life at some point, and you think, well, they're just there and you can't really do anything. You just have to support them the best you can. And they just sort of have a mind of their own. And I think it's like in the back of your mind as a woman, you kind of want this feminine part of yourself to be balanced and be its best and everything, but you don't think something like aligning your fascia can help with symmetry in that area.
Right. And I think that when you show the one with my arms down, we'll see that more.
Even more.
Yeah.
I also want to say, we'll just look at this really quick. I want to say that I'm trying to move this picture up. It does not want to go. Your knees look a lot less congested in this after picture. You can see like just right above your kneecaps and that problem area that all lipedema women are frustrated with. It's cleaner all through here. You have, I can zoom in a little bit. Some of these lines on your knees, you can see they're softening in your after picture. And those are just grips of your fascia and they're loosening. And so your knees are going to feel better. Your knees are going to have more range of motion, be back where they need to be. And that will also help your hips be in line.
I have an interesting observation. Well, I don't even think I've mentioned this to you yet, actually. Maybe I have, but we've talked about so much.
Okay.
I'm actually able to be on my knees, like on all fours
Yay.
for a bit, for like 5-ish plus minutes with like very minimal pain. Like I can feel it a little bit, but before it used to be that I would try to sit on my knees and the pain was excruciating. I couldn't even be on my knees. Like I've taken, Pilates classes and, bar classes and other classes where I'm like, I can't do those moves because I can't be on my knees. And so I'm starting to be able to be on my knees, which is crazy because I can't, it's been a very long time, more than a decade.
That is really exciting because I had a similar experience. Because, I try to like clean out under the bed or something, or just normal life. You sometimes need to be in that position where your knees are on the ground. And it has been so incredibly painful. Like I would do anything to avoid it because it hurts so much. And I've had a similar change. And I know that is just, it's so exciting with these little things that you think they're just part of normal life, but you literally haven't been able to do them for years and years and years.
Yeah. I used to work in a warehouse on concrete floors, and I would actually be able to kneel down all the time for my job and kneel on the concrete just fine. And then as I just like my lipedema started to get worse and I got in perimenopause and everything was kind of progressing, I wasn't able to get on my knees anymore. So now to be able to do it again and not feel excruciating pain immediately is pretty amazing. And the fact that it's happening so quickly. So
that is so exciting.
I know.
I love when people just gain back part of normal life. You would think like these huge shifts are what people want, but really these little moments of like just gaining back normal function, being able to kneel, being able to raise your arms with a good range of motion, those are such victories.
They are. It's huge. I mean, those are my two things. We're just, I don't want to lose my mobility. And actually, it has been creeping away, over the last decade and a half, like not being able to get up and down easily off the floor, not being able to kneel on my knees. And, obviously you can see I have range of motion issue with my arms and all that affects everything, our day-to-day tasks. And so, yeah, it's pretty amazing to get those back. With this super easy, like conservative method. It's so simple. So
are you ready to look at this next set of pictures we have?
I am. Yep.
Okay, let's see what we got.
Okay, can I go?
Go.
For me, it is my shoulders. It's insane. Like in the before picture, I'm tilting to the left. Like everything on the left side is lower. That left shoulder is lower. That arm is longer than the other side, which makes my other arm look like it's crunched up, but it's actually everything's lower. And you can even see like my breast. That left breast is like way lower than the other side. And I think it's just because everything was dragging down over here. And again, I thought I was sitting up straight, but you can see just after a month, the line across my shoulders, how much straighter I am, my breasts, like how much straighter they are. And even my hands are a little bit more in alignment. So, my head again doesn't look so forced backwards and just
look at the length in your neck. And also the front of your neck right here. And I know you have some thyroid issues, but look at the inflammation and look at the decrease in just a short time. Also,
Yes, I have had that since 2003, thyroid issues.
yeah,
Yeah.
it is amazing. The decrease in inflammation, and in your face too. Your face looks different. I was going to say, we talked about it before the call, but this line of this angle of your left side through here, it's also this crease in your eye. It's at the same angle.
Everything's pulling. Something
Everything's
has been
pulling.
pulling.
Yeah.
Yeah, and I have always noticed the asymmetry in my eyes, especially next time we do an update, I'll have a before and after close-up of my face as well as the sides of my face. But that left eye has always been just a little bit like droopy and smaller than my right eye, which now I'm coming to realize is probably because of the restricted fascia. So yeah, just seeing how asymmetrical I was and just leaning to the left and how quickly everything resolved. And at this point, I had only like specifically worked on the shoulders, I think one time, and
Mhm.
under the armpits, which helps the shoulder area,
Yeah.
twice in a month. And so to see how little you do in specific areas, but you get such a massive change in those areas because everything is connected. So it's just
It,
fascinating. It just makes me
it's
more excited about fascia and this journey that I'm on.
the other thing that people need to know is like your feet are connected all the way to your jaw. And so you did a lot of work um, in your on your feet.
Yeah.
And it's kind of harder to see. Let me see if I can move it up. Um, I can tell a lot of difference. Your ankles have lost a lot of that inflammation. They're not as wide in the second picture, but also these little lines right here
Right.
and these over here, those are somewhat due to inflammation because, you get all that stuff with inflammation, but also those lines on your ankles are fascia adhesions. And if you look in your after picture, there's so much. I mean, on this leg, you can hardly even see them.
Right.
And on this one, there's so much less. Um, the other thing you talked about were these lines on your thighs.
Yep.
They're more prominent on this one, but you can see them here. And over here, they're just like a shadow. They're barely anything.
Yep.
So many changes. It's
And look
crazy.
at how like my hands and my arm, the right arm, it'll look more relaxed in that after picture. It just everything on my body is changing with just a little bit of work that I put in. And so it's super exciting.
I'm excited too. Your knees are more in alignment. This one is
Mm-hmm.
facing, it's like rotated outward. And with this one, it's coming back in alignment. Your knee should
See that.
actually be like over your second toe.
Okay.
Uh, and so you can see this one, it's not quite, but the other one's pretty straight. Um, I just love all the changes that you've had.
Me too. This body of mine needs this work. It needs a lot of work. I'm like, what area do I focus on today? I have so many areas. But the interesting thing is, like, yeah, you can work on your toes or the arch of your foot, and it can affect all the way up.
It
And then,
does.
so,
I love the more symmetry in your calves. Like this one is bigger in this picture. And you
right.
also have this line right here down your tibia.
Mm-hmm.
And in this picture, it is so much better, but your calves are so much more balanced in themselves, but also both legs are more symmetrical. And that's going to make such a big difference in like from your feet all the way to your head. Just
And
so
how I
huge.
feel. And yeah, I'm noticing that I'm just walking a little bit differently as well, and just becoming more conscious of my body. So
Yay.
I know it's exciting.
Okay, let's see what the next. I don't know which one it is. We'll go with it, whatever it
This
is.
one. Yeah.
Yay.
Okay. So what stands out to me big time, and I'll know you probably point out a couple other things, is like up here at the top, that whole upper back and my shoulders, it's rounded forward in
Mm-hmm.
that June 1st picture. And then it's not completely straight because this is a progress picture and I'm still on the journey, but it has flattened out a lot more. And the base of my neck is not as scrunched.
Mhm.
And again, the shoulder symmetry, I think, was more obvious in the front picture, but for me here, it's the roundedness. It's like everything is pulled forward. And then in the July 1st, I'm just straighter. And then also the butt clenching. Can we talk about butt clenching for a second? Before I even started block therapy, I became aware that I was doing this because I have a lot of lower back pain, like right in that lower back upper buttock area has been so painful for me for years. And I started to learn about like, okay, you know, butt gripping, and you're doing it unconsciously as I was standing. I'm like, why am I clenching? And it kind of has to do with stability. And to see there that I'm not just like clenching and holding as tightly and everything is straightening out. So, I mean, there's other changes, but those were the two that stood out to me right away.
Yeah, that's also connected with like your pelvic floor, which I know you've had some
Mm-hmm.
issues with. So you can just see like your torso has lengthened, your butt is dropping back where it's supposed to be. A
Yep.
lot of those adhesions, it's interesting to me that like the adhesions in this area release, and so that allows those glutes to drop back into where they're supposed to be rather than having that shelf
Exactly.
that all the lipedema women are like, no, the
The
shelf,
butt shelf.
the butt
The
shelf.
butt shelf. And actually, you know, previously I had thought about surgery. It's not really something I'm thinking about right now, but I thought, wow, if I ever do have surgery, that's going to be the area that I'm actually ask the surgeon to do first because it's so painful. It's much more painful than my legs. It's very fibrotic there, like at my hips. You can just kind of see that just
Mm-hmm.
it just looks like really firm. And that butt shelf area was so sore. Like I couldn't do dishes without taking a break because that lower back was always killing me. And so you're exactly right. It's like it's tilting back into the position, not such a like forward anterior tilt, which puts a lot of pressure on your lower back, like it's coming back to where it should be. And then I know if you can take your mouse and show that like grip or adhesion over there on like the left side buttock, where it's kind of going down like this, and it just you can see that tightness, and then
Yeah,
everything just kind of relaxes and
all
goes
of that.
back to where it should be.
Yeah. I also love the lengthening, and you didn't lose much weight. You did lose a little bit, but all
Yeah,
of this right here is just being reshaped. Everything it's just a different shape from the roundness to the sides of your body here. There, your top is fitting in a completely different way.
yeah, it wouldn't even, I thought that my bra was down in the back, and as you can clearly see, it wasn't, but it kind of makes sense because everything was being pulled forward,
Mm-hmm.
including my bra. You know, everything was forward, and now it's like I'm coming back into alignment, and so clothing is like sitting where it's supposed to. And just seeing that area, that butt shelf area, how it's like coming down and relaxing, no wonder I'm having less pain already. And it's just going to get better right now. So,
I think that is a good place to end our part one, so
yep.
everyone can stay tuned for part two.
Yep. Thank you.
Thank you.